Welcome back, East Texas. Well, September is National Pain Awareness Month, and Dr. Peter Sirianni, Peter, from CHRISTUS Trinity Mother Francis is here to tell us about pain treatment.
Thank you so much for having me back and helping us raise awareness about this important issue. For definition purposes, chronic pain is defined by authors as pain that lasts for greater than 6 months. So the pain that just won't go away, it's affecting your daily activities, and it's starting to get to your psyche, and those around you notice what that is. If you think about it, pain is the only symptom that we've all experienced. You know, you get patients that have this kind of symptom that doesn't discriminate gender, doesn't discriminate as far as age, whether it be a child or an elderly patient. So everyone knows what this symptom is. What we have seen, Johns Hopkins has reported that from a cost, annual healthcare costs, upwards of $635 billion is spent annually on chronic pain issues and then taking care of these patients. This rivals cardiac disease, it rivals diabetes, and it rivals cancer costs. So we're trying to raise awareness, let people know that I would venture to guess that every one of your viewers knows somebody that deals with chronic pain on a daily basis. And what we're trying to do is reach out to that patient, because what generally happens is they internalize that daily pain, and then this usually will manifest as depression or anxiety, and then they become isolated from usually their loved ones or the group people they spend time with, and a stigma forms. And we want to reach those people and let them know that we've got a comprehensive way of treating this condition.
Sure. So what kind of treatment plan do you all offer at CHRISTUS Trinity Mother Francis?
It's been well established that pain is a far-reaching problem and it's very complex. And we have found that if you employ a comprehensive approach, and that includes physical therapists, occupational therapists, internal medicine doctors, physical medicine rehab physicians, internal pain physicians like myself, neurosurgeons, neurologists, and psychologists. And if you take on that patient and their histories, their imaging, their pain pattern, and have a team-oriented approach, they may spend more time with one individual skill set in that team, but by and large, they will improve because you're getting them in real time in a cooperative effort to take all these aspects and improve their lives.
Okay.
And we do that. We've done that at CHRISTUS Trinity Mother Francis. We've been very, very happy and successful with this approach. With the use of electronic medical records, you may see a patient today, and you notice something. They told you something that's maybe new, it's kind of like a CSI puzzle when you put this together, and you want to tell me about it. Well, then you let me know, and in real time through our EMR, I see it. I say, okay. Then the patient may contact me on my chart, which is very impressive. So we've got a dialogue going, and the person, the ninth person on the team is the patient. And too many times, and you probably all experience this, where sometimes a doctor talks over you, lets you know what's going to happen. But when you include the patient, they do so much better, so much better. You know you've connected with a chronic pain patient when their eyes light up and they look at you and they say, so I do have a reason to hurt. And you look at their imaging and they're presenting the story and you say, you have like 5 reasons to hurt. And that right there is the first step in the healing process, because they don't feel like they're losing their mind.
Sure.
The social stigma usually comes from those around them. They're often seen as maybe, it's in their head, or they're overreacting, or they're drug seeking. And we're trying to raise awareness and education for these people and let them know that this is a real issue. And with imaging and the diagnostic team that we have, we're able to hone in on the problem and hopefully remedy the problem.
Great.
Sure.
Well, Dr. Sirianni, thank you so much for joining us. We're going to have your contact information on our website, easttexasmatters.com. And coming up after the break, football season